people have taken a serious interest in their own health. They're not relying on others. They're not just relying on their doctor. They're actually doing their own reading. And so they're coming to some of these events, whereas maybe before we would have only got physicians or healthcare professionals. We're getting health conscious individuals. And so this symposium that we organized is for anybody who's health conscious, really. But what we did is we kind of searched across Canada and said, who are the key players here? And let's talk to them, and let's put together a symposium, November 1, 2, which is International Vitamin D Day, as you know. And so we were very fortunate to connect with Reinhard Wief. He's professor of medicine at University of Toronto. Again, has worked in this area for his whole career. So he will be kicking off the symposium. And then we, got Michael Hollick, who is an American, but at the University of Boston. But I mean, he's sometimes referred to as the godfather of vitamin D. And he's closing out the symposium. So we've got these two at the bookends, if you like. And then in between, we've got a professor from McMaster who's right now involved in a vitamin D study for children who are critically ill. Anybody who wants to understand vitamin D in children and in critically ill children and what doses they're giving and what type of vitamin D, he's going to speak about that. And then we've got Dr. Linda Rapson, medical doctor who has run a pain clinic in Toronto for a long time, 30, 40 years. And to her and her clinic, vitamin D, magnesium, and other nutrients are key to pain management. And so she's going to be talking about that. And then we have another formulator, a nutrient formulator, and just a biotechnologist, Dr. Armin. And he's going to be talking about how you measure vitamin D. And you might measure vitamin D, for example, in a research trial using mass spec. But that's not going to help you and me in the general public because that is terribly expensive. So he's going to be talking about other ways you can measure vitamin D and when they're appropriate and in what context. So if you're going to use a dried blood sample and send it to Immunoceutica if you're in Canada, or send it to Grassroots if you're in the US. Or what about if you're a healthcare professional? Are there rapid tests right now on the market? And yes, there are. What does that technology look like? So he's going to discuss all of the testing. And then we've got Dr. Aileen Bradford Mason, who again, you may know her. And she has been looking very closely at the sort of recommendations from the Endocrine Society. She's been looking at that quite carefully. And she wants to really speak into that, into those recommendations, where she thinks that those maybe should be adjusted and why. And maybe why the Endocrine Society did that. I won't get into that. That's not my area of expertise. I mean, at least they did recommend certain groups be tested. But here's the other important thing. And then we're going to have we have another professor who's coming to speak about the immune system in vitamin D. And then we have Dr. Carroll. He's an immunotoxicologist by training. There's a whole lot of information sort of on the toxicology and the genetic side. He will address all of that. And he's got the credentials to do so, because everybody wants to know, oh my goodness, how about if I take too much? It's a rat poison, right? Like somebody's going to tell you, oh my gosh, it's a rat poison. Well, guess what, folks? We are not rats. I just kind of walked through all the species differences, and we are not rats. And so even though it may be used in a rat poison at ginormous doses, right? That does not mean. So again, we're trying to educate the people. to understand what's actually going on. And I think we have a cadre and a nice mix of sort of academics and healthcare professionals, medical doctors, chiropractors, naturopaths, that whole thing. So we're really hoping that people will either come to Toronto or join. It's a live webinar and just see sort of the very latest in what's going on.
It's really for everybody.
It's for
And
everybody. Yeah, we say it, any health conscious individuals.
yes, I got that. And I love that.
Yeah.
What is the difference between the 2 days? Is there any difference?
So one is more a boutique, like the Chatham event. Chatham is outside Toronto. It's going to be held at a golf course. It's got limited space. I think it caps out at about 220. The people may get a little more time to have sort of lunch with the speakers, that kind of thing. It's not quite as tight timeline. We can mix and meet and greet a little bit more. The Toronto venue is the big venue. We can take more people. It's close to the airport. So we can have, some of the speakers are coming in from other provinces. We can get them in there pretty easily. We can pick them up. They can be at the venue within 20 minutes. And this is a key factor. So how are you going to get an interpretation on your results? And then how often are you going to be tested? What are you going to do now? I'm going to guess how much I need. No, you're going to test, and then you're going to work with professionals that can help you get to optimal, and then you are going to retest, because this is personalized medicine. Everyone wants personalized medicine, and guess what? This is one area that we can absolutely offer personalized approaches to your health, because now you can retest and we can see how you're doing. And interestingly, some people, supplements, they're not working. And that is the clue that there is a genetic, they're called single nucleotide polymorphisms. There is a genetic switch somewhere that's not working. Well, you're never going to see that if you don't test, right? And somebody help you. And that might mean you take a different form of vitamin D. But if you don't know, you can't do anything about it. So it's really test, don't guess. Are you getting enough? Oh, I don't know. You better test. I was like you. I thought in the summer I'm outside enough. I'll be fine. But as soon as I tested, I went, whoops, no. To keep me in that optimal range where I am not at risk of breast cancer again, for example, I need to be testing, and then I can feel confident. And we've also had people that are taking forms of vitamin D that don't work very well, and so we have to say, let's switch up. People don't realize, it's a fat soluble vitamin. You're going to have to get some help there. So I think that's the main message. And that's why we said, are you getting enough? Let's figure that out. And then how can we make sure you are getting enough? Test, don't guess. So I think those are the take home messages that every single citizen needs to understand.